Hey everyone, welcome back to New Method Live. So excited that you're here. Today's topic, today's episode is going to blow your mind. If you're someone who's sensitive to everything, right? Like some days you wish you lived in a bubble, you need to pay attention to this episode today. Or if you know someone like this, you need to pay attention to this episode today because not enough people are talking about this. Some of you may have never heard of this, and maybe you don't even know that there's a name for what you're going through. But if you're that person that gets a headache when you smell perfume or a candle, or if you don't eat super clean, you're doubled over in pain. And if you're one of those people who feels great 1 second and then 1 second later, after going to a certain store or someone's house, you're absolutely wiped out and you can't figure out, this episode is for you. And if you're one of those people, I'm one of those people, you probably feel crazy. Like, why isn't everyone getting a headache from this person's cologne? Like, and everyone says you're so sensitive, and you are. But when you go get it checked out, you go to the allergist and you go to the rheumatologist and you go to every ist there is, you do all the tests and it comes back normal. And you're like, okay, now what do I do? And you've probably been to different doctors and specialists and allergists and ENTs and neurologists and undergone a million tests, but everything comes back normal. But you know it has to be something more because in reality, you get these headaches or these symptoms or these rashes. So this episode is for you because if what I just said really resonates with you, if this describes you, you might have something called Mast Cell Activation Syndrome or MCAS. And that's when your body is on super high alert and it's mistaking even the mildest sense, foods, triggers, and it mistakes it for serious threats and it's reacting to everything. So, this is what we're going to talk about today. We're going to break it down as usual. But before we do, I always want to let you know how to reach me and my team. If you're watching this live, drop the word live. Let us know you're here. Make this interactive. Ask us questions. We will answer. If you're watching on replay, let us know by dropping the word replay because let us know that you're here even later on because we can answer if you have questions as well. If you're watching on YouTube, don't forget to like and subscribe. And if you're listening to the podcast, I'm wearing a white sweatshirt today and my hair is still wet from the shower. Other than that, you're not missing anything. And of course, if you aren't already following us on Instagram or TikTok, what are you waiting for? Because we're super entertaining. Okay, we got through all that homework. Let's start. I always start with a definition. What are mast cells and what do they do in the body, right? Before we get to mast cell activation, we need to know what a mast cell is. So we need to define what mast cells. So mast cells are like the body's security guards. They're stationed in areas of the body that interact with the environment, like your skin, your lungs, your intestines, your blood vessels. And they're basically standing guard. And when they spot a threat, like an allergen or something, an invader, they spring into action. So now I want you to imagine that these mast cells, they're not just hanging out there, they're also equipped with little balloons or sacs known as granules. And those granules are filled with chemicals like histamine, prostaglandins, leukotrienes, who cares? They have lots of chemicals in there, right? Now, when everything is normal, the mast cells are like peaceful security guards. Excuse me. They're just hanging around carrying their weapons, but not firing until an intruder comes along. And if it senses a potential threat, such as a harmful bacteria or a virus or an allergen that's invading your body, the response is immediate. It pops these little sacs, which release like a cocktail of molecules. And this process is called degranulation. And when they release their chemicals, it causes the area to get swollen or itchy. It causes a reaction. Right. So let's talk about that classic thing that many of us are familiar with. That person with a peanut allergy that accidentally eats peanuts, that peanut is now classified as an intruder, right? The peanut allergen, and it just went inside kind of the security perimeter. The immune cells are going to react. They're going to put these little wanted posters out. These are called IgE antibodies. A little technical, but I'm trying to make it metaphorical. And now these wanted posters circulate around. And when they find a match, which is the peanut protein, they bind to the mast cell. And that mast cell now recognizes a threat and responds by popping its balloon with histamines and is sending out an alarm signal. And that causes the allergic reaction, the hives, the itching, sometimes even difficulty breathing. Right? But their job isn't just about sounding the alarm, mast cells. It's a more complicated job. They're also part of healing and defending. So they're also releasing not just the histamine that we associate with itchiness, but they also release other chemical factors, cytokines and other mediators, because they're trying to bring immune cells to the scene, right? They're trying to bring like a repair system to the scene. So the point is, mast cells activate an inflammatory response, which they think is needed for repair. They don't really think, but you know what I mean. And but remember, because inflammation is a good thing when it's short term to help heal and repair. You fall down, the area gets red, a whole bunch of healing molecules come in to help and repair. But of course, the problem is when it's chronic. Well, bottom line, mast cells are key players in both immune defense and repair. And in normal situations, it's really good that the mast cells respond when they're supposed to. And when everything is quiet, they just kind of stand watch. That's really good. That's a wonderful system. However, you can see that this is something you really want to keep in check, right? You don't want your mast cells just activated all the time. But for some of us, that's exactly what's happening. Our mast cells are too jumpy, too eager, like an oversensitive car alarm that goes off from the slightest touch. They react to everything. This overactivity happens when the mast cells become dysfunctional. So let me talk to you about what some of the symptoms of MCAS, mast cell activation, is. So it could be a whole host of things, which is why it's so confusing. It could be GI issues, abdominal pain, nausea, vomiting, diarrhea. It could be respiratory, wheezing, shortness of breath. Cardiovascular, you can present as low blood pressure, tachycardia. Neurological, can cause headaches, dizziness, brain fog. Allergy-like symptoms that come and go. You can have sensitivity. Your skin becomes red and inflamed when it's scraped or touched. You can have sudden flushing of the face. You could suddenly be really intolerant to heat. You're super sensitive to certain environments. You could just be super fatigued, or you could be someone who gets sick easily, right? There's this is what makes diagnosing it so hard. We'll talk about that in a moment because it just sounds like so many things. But people with mast cell activation, when they go into a candle store with all this like good scents and they smell that, they can have a severe headache or dizziness or seemingly randomly break out in hives. And then they go to the allergist, but they're not allergic. Right? So many of them have, or some of them have like GI issues, and then they go and they get diagnosed with IBS because all the tests are normal. But in fact, what's happening is that the mast cells are constantly panicked. They think they're under attack and they set off an alarm in every place it goes. This is mast cell activation syndrome, MCAS. So, MCAS, as I was alluding to earlier, it's called the ultimate chameleon. It is so hard to diagnose. And it is so easy to misdiagnose it, right? Because you could say, oh, you have allergic symptoms. You're probably allergic to this. Or, it's one of my favorites, not IBS, right? You could say, oh, you just have IBS. You know how I feel about IBS. But think about it. The person who seemingly random abdominal pain, diarrhea, bloating, they get the endoscopy, they get the colonoscopy, and everything is fine. IBS comes to mind. Or you might be diagnosed with anxiety or psychosomatic disorder. Like, really, every time you go into a store, you have a headache. Maybe you're just anxious, right? And I already wrote a book called It's Not in Your Head, because it's not in your head. Anyway, guess what else it could be diagnosed as? Fibromyalgia, right? Due to the chronic pain and fatigue, all normal labs, you might walk away with the diagnosis of fibromyalgia. You might be called chronic fatigue syndrome. You're the person that goes somewhere, you wake up, you feel fine. Maybe you go to work, maybe you go to a store, maybe you go to a friend's house, you go to the mall, you come back, you're wiped out. And you might be diagnosed with chronic fatigue syndrome. You might be diagnosed with POTS, postural orthostatic tachycardia syndrome. Now, sometimes POTS and MCAS can coexist, but sometimes what you think is POTS is really a reaction to the environment. It could be GERD, right? So you're starting to get the pattern here. There's so many things that it could be or it looks like. And it takes a really long time to get that MCAS diagnosis. All right, so now we kind of know what it is. So let's understand a little bit more about why this happens, what causes it. So as I said, it's overactive mast cells. But what's happening here? So the first part, some people just have a genetic predisposition, right? Maybe their parents have it, their uncle has it. Some people have certain genetic SNPs, their little variations, and that really tells our body how our mast cells are going to function. But just because of the genetic component doesn't mean it's like passed down. It's not like eye color. Like it is what it is, right? There are certain genes that you have to have triggers in the environment from. That's what we call epigenetics. That means how does the outside world affect our genes? So think about it this way. I love to give this example because people can really connect to it. If grandma has diabetes and your aunt has diabetes and everyone has diabetes, if you're someone who doesn't eat a lot of carbs, you're not going to automatically get the diabetes, right? You have to have an environment full of a certain lifestyle to turn on those genes. So, same thing with MCS. You may have a genetic predisposition, but the environment around it can turn it on. And that's important because if we just think it's genetic, well, then there's nothing we could do about it. But when we realize that we can change our environment, there's so much that we could do. So, what we're trying to avoid, what is this environment? What am I trying to avoid in MCAS? Right. And the name of the game is always, 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 yes, always inflammation, right? Something's causing inflammation in our body that is now telling the mast cells to be activated, right? So they think it's an invader. So we have to like pull back and say, okay, what causes inflammation? What could possibly be in my body all the time, 24/7, that keeps my cup really full of inflammation that might then trigger my mast cells to react? So classically, the most classic, patient that has MCAS usually also has mold or toxins on board. Now, this is a little bit of like a chicken egg relationship because, on the one hand, people who have mast cell are sensitive to mold and they're going to react to mold, right? And they can create an overreaction because they have MCAS. But on the other hand, people who are just constantly exposed to mold in their jobs, in their home over time, are in this chronic inflammatory state. It's called CIR, and then that inflammation can trigger MCAS, which makes them more sensitive to the mold, right? So you could see how that's a situation. But either way, the bottom line, it's common for people with MCAS to also have mold toxicity. So if you think you have MCAS, you might want to consider getting tested for mold and, of course, being treated. Another source of chronic inflammation, right? Chronic inflammation, what's happening in my body, what's happening there all the time that is causing my body to constantly react with inflammation, right? And of course, what am I going to do right now? As always, use a tissue for my nose because sometimes when I speak, this is what happens. Anyway, um, so remember, so that we're back to chronic infection, right? So infections can be a trigger for symptom flare up, right? Because we have this underlying inflammation. So what are we talking about? We're talking about the people with chronic Lyme, the people with long COVID. This means there's this constant state of infection, constant action that's happening that causes inflammation. And of course, chronic inflammation can come from your gut, right? This is why we focus on the gut. MCAS is connected to leaky gut, to SIBO, small intestinal bacterial overgrowth, dysbiosis, H. pylori. If you have H. pylori in your belly, that's a constant source of inflammation. You got to have to check that out. Now, why is this even more important with the gut? Like, yes, mold, yes, Lyme, but the gut is even more important and more of an issue because remember, mast cells are part of your immune system. And guess where most of your immune system lies, right? 70% of your immune system's in your belly. So if your nutrition is off, your belly's off, you have a constant fire in your belly, you're going to set off your immune system, which includes the mast cell. So calming down that belly is really essential. A surprising thing that's connected to MCAS is vitamin D deficiency. Vitamin D deficiency is linked because vitamin D is a critical piece of the immune system, right? So we've discovered that vitamin D helps regulate mast cells. Low level of vitamin D increases inflammation, which makes MCAS worse. So you definitely want to get your vitamin D checked. We all should have our vitamin D checked regardless. So how is MCAS diagnosed? This is a really hard one. It's really hard to diagnose a mast cell. You have to kind of like get in tune with the story and the history because it looks like other medical conditions, right? We talked about that. So it takes years, years of various tests and diagnosis and treatments before you get to it. There's no single test that definitively confirms this diagnosis. So this is how it goes. You have to have a clinical criteria, meaning this sensitivity, this discomfort that feels random, the headaches or the rashes, etc. And then you first have to go to all the providers. You always, always, always have to rule out other conditions. Never let mast cell activation syndrome be your first go-to. You have to rule out. If someone have headaches, go to the neurologist, get the brain MRI if recommended, right? If you have stomach issues, go to your GI, get the endoscopy, get the colonoscopy. Rule out. You must rule out other disorders first, and then it kind of becomes a diagnosis of exclusion, meaning you ruled everything else out. You also can see if you have a response to certain medication. I'm going to go over that a little bit in the treatment section. But sometimes if people just feel better once we start treating it, you can kind of diagnose MCAS. So there are some lab tests, but to measure various inflammatory markers, but they really don't point you definitively in a direction. So you just have to fit the profile and work with somebody who recognizes. So the next question is going to be, how do we treat it? Okay, we got it. We know it is. We know we can't diagnose it. Probably, if you're listening, if you're this far in, you probably feel like you have it. So how do we treat it? If the name of the game of MCIS, if the main issue is inflammation, we have to calm down inflammation. Right? That's how we treat it. So always start with your belly. Now, I say always start with your belly, not because I think that if we just fix your belly, everything is going to get better. But you have to start there because mast cells are your immune system. And as I said earlier, 70% of your immune system is in your belly. So why would you start anywhere else other than the place that holds most of your immune system? Not going to get all into it, but 5R approach: remove, replace, reinoculate, repair, rebalance, right? That is how we fix the belly. There's a whole other episode. You can check it out on how to heal the belly. So we're going to do that. After your belly is on point, you can also focus on seeing if you have some molds or toxins and removing them, right? Mold testing if you think that's it. Chronic Lyme testing if you think that's it. I've done episodes on those as well. H. pylori if you think that might be it. And each one of these has its own protocols to kind of help you get rid of these toxins, molds, or infections. But also, you have to be careful to avoid new toxins, right? So that means you have to live a life that doesn't include new toxins, right? Drinking water, making sure you go to the bathroom every day, sweating, right? You want to live a lifestyle that focuses on getting rid of toxins. I know I always say this, and I'm sorry if it's boring, but another key piece of anti inflammatory is getting enough sleep. And by the way, if it looks like I didn't get enough sleep last night, it is true because last night we were in the city and my face was in Times Square. So we stayed out a little bit later than usual, but I did not want to miss um, putting this live together for you guys. So excuse the eyes. But if you're not sleeping, you're in a constant state of inflammation. And if you're in a constant state of inflammation, don't expect your MCIS to get better. We have to get that better. You guys always want to know about supplements. So let's talk a little bit about supplements. But remember, supplements won't work if you're not doing all the other things I just talked about, right? So here are some basics that you want to include. Um, DAO, right? So remember we said mast cell activation is a histamine, and diamine oxidase, DAO, is the main enzyme that breaks down histamine. So if we're having a histamine reaction and you take DAO, you could break down the reaction. So there are supplements that have DAO enzymes to help break it down. Now, there's also other natural antihistamines. Remember, antihistamines like Benadryl or Zyrtec, which are great for severe allergies, but not necessarily something you want to take every single day for MCIS, right? So there are natural compounds that help you block histamine from binding and triggering symptoms. But please, 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 if you're having a severe allergic reaction, these supplements are not the place to go, right? If you're having a severe reaction, make sure that you know how to get those medications and use them appropriately. This is for long-term, kind of chronic antihistamines to get those on board. So the list is vitamin C, stinging nettle, butterbur, bromelain found in pineapples, and quercetin. Quercetin is amazing for antihistamine, especially if you have respiratory issues. So pick up some supplements that combine all of these into it. And of course, vitamin D, because we talked about vitamin D and we need to have it. Now, I just want to say one other thing. For some of my clients, for some people who have severe mast cells, like it's really debilitating, sometimes the supplements and the lifestyle will not be enough. And there is a protocol that includes medication. It has ketotifen in it, cromolyn sodium in it, Pepsid, together with the supplements and my patients with MCAS, we slowly titrate, like increase this protocol until the symptoms are calmed. Now, I know I didn't go into detail here because it takes a long time, but I just want you to know that if you think you have MCAS, work with someone who knows what they're doing with MCAS. So here comes the end of the episode. Let's do a quick recap. I always laugh because if you don't know by now, there is a GIF out there that I go like this and says recap, GIF or GIF, however you pronounce it. If you have an iPhone, just go on the GIFs, type in the word recap, and you will see me going like this. Anyway, recapping. Living with MCAS can make you feel crazy. You're always with a headache, you're always sensitive, and everyone else is fine. And it's so frustrating because it's hard to get a diagnosis. It could feel discouraging, it could feel frightening, it could feel isolating because there's so many things that you opt out of. No, I'm not going to go to the mall, I'm not going to go to the store, I'm not going to go to the concert. I can't handle, all those perfumes. You might have to change careers. And so you're opting out of so many things because you feel so unwell. My hope is that this episode can give you some light in your journey for those of you who've been bouncing around from doctor's office to doctor's office. Hopefully, you can get some light here. And whether you work with me and my team or find another provider that knows what they're doing with MCAS, I want you to know that there is a way out. It will take some time, but you can conquer it. Remember, you're here because you always knew there was a better way. I'll see you guys in the next episode.